Hi, wisdom seekers. This is Dr. Sherry Shoemaker, and I am where spirit takes me. Today, I was thinking about sequences, patterns, healthcare, and how we take care of each other. I have my magic crystal here, my magic wand crystal, to help give me inspiration as I speak. And one of the things that stood out in my mind, one of the topics, was Planetree. Planetree is a nonprofit organization model, and it's a Planetree model is what they call it. And it is about patients being taken care of as human beings, not as scientific or examples of tests. So they are to be treated as human beings, which of course, I spent a lot of years in healthcare, and I get both sides of that because there was a certain amount of, you had to keep everything a certain level of cleanliness, so you couldn't just let everybody in. Even if they were family members, you needed to keep the patient relaxed and quiet, some people thought, and that not letting the family come in would be most beneficial, and in some cases that is true. But there was also a lot of ignorance and not allowing family and patients to interact because it was scary. It disrupted the whole movement, the whole discipline of being in an environment, a controlled environment like a hospital. So Planetree came along, and this was over 25 years ago that they first started, and they've been building and building, and now they're across the country. And because I think other countries have always had this thought that family members can be very beneficial and can really help the person. So the first Planetree hospital that I ever saw or worked in had things like the colors were very soothing. They had patterns on the floor. It was a Fibonacci pattern that was a theme throughout the hospital. Which gave it kind of natural look to it because there's a lot of that pattern within nature. And it also had patient care advocates. And those advocates were family members or patient care partners. So both of them would actually help take care of their loved one in the hospital, the person who was the patient. And that put a whole new skew on how, nurses, doctors, lab techs, anybody, x-ray technicians, anybody that interacted from the hospital side also interacted with the family. And it just gave it a whole new feel of really everybody wanting that person to get better. It wasn't, no, you have to stay over here, and we know you're concerned, and we'll talk to you later. It was, here, let's have a discussion. You want to ask me questions? I am open. I am open to answering questions. It was such a wonderful experience. Now, people are people. So some people are not as caring as other people, and that includes family members. And some family members don't want to be involved, and they want to just put the person in the hospital and say, you take care of them, I'll be back, I'm going on vacation, I'll be back in 2 weeks. And some people find that off-putting, and then you have to work with the patient who has that kind of family dynamic. So what is my point? My point is we are still learning how to take care of each other. We are still learning how to be caring. We are still learning, and we have it in us, but we haven't let it out yet. So how do we do that? Well, we have to know that our heart is open. We have to know that we can allow to give and to receive. So when we're in a situation where we can help, we do. Sometimes people just help and help and help and help, but they can't receive. You have to learn to receive also. When you're in a hospital, you have a certain amount of lack of control. So people are doing things to you. Well, you can look at it that way, or you can look at, I am being helped by people who really want to help me. I am going to allow them to do what is necessary and to really involve myself in my health, involve myself in my care. We need to allow all of us to give and take. So some people take all the time, and that's not healthy. And some people give all the time, and that's not healthy. We have to learn to have a balance and have this motion of give and take. And it can be seen in nature, and how nature moves from summer, spring, fall, winter, spring, summer, fall, winter, spring, summer, fall, winter. Trees die, trees revive, leaves fall, leaves grow, flowers move. And we've learned that from different things in nature, which is so important. So when you're feeling like you're not getting what you need, you're not in the right place, the people are not helping you, nobody knows what you are going through, think about who you are, where you are, and open your heart. Go inward. Remember who you are. You are a soul and a body. Get back to your soul and allow and receive, and it will become clearer. So stay inspired, stay curious, look around you, keep your head up, keep a smile on your face. Know that you are exactly where you need to be. It can be better, or it can be different. It's up to you.